got so motherfucking design on right now.
Hello, everybody. Welcome back to another episode of Unscripted with Nurse Besties. And I'm Jessica Renee. And
I am the co-host, Calm Couture Wellness.
yes, as you can tell, I don't usually do the intro. So I will be back. My next turn, I will be ready. I usually just sit and mindlessly smile, just be like, until you say my name. I wasn't ready.
Switching it up before we go into the new year.
Yes, and right into the new year, right? We're already here. But I know if you have been catching us for now, our third episode, you see a new face. We have Charity here with us, joining us today, our first guest on the podcast. So yeah, I guess we'll introduce later. We just didn't want to be like, who was that on the screen? But you're in for a wonderful episode that we have scripted for you. But first, I guess we'll get into just how's everybody doing? How's the week been? The month? Anything new, ladies?
So, as always, happy to be here. Happy that this is our third episode. So
yes.
Shout out to us and
very proud of you guys.
Third episode, third month. Yeah, our baby is 3 months old.
3 months old. We had, as you can see, we are nurturing it, nursing it, and just really happy for all the love. Again, we can't thank you enough. All the love and everyone reaching out to one of the guests. Shout out to our first guest this evening. That's it for me. Just excited.
All right. So I guess we might as well just jump on in. We have a wonderful guest, my friend here, Miss Charity. Charity, do you want us to just call you Charity, or should we say chronically fabulous?
We should say chronically fabulous. That's
absolutely.
That's my baby.
Yes. We have Miss Chronically Fabulous here with us tonight to really just educate us, give us her story as she is doing wonderful things with her page and with her business for healthcare and for, I don't want to give too many details, but she's doing amazing things for her community, as well as coming on tonight to educate us as healthcare professionals on that other end of it. I think we've kind of talked about not only us being in the field, but it's also good to get a different perspective from people that are actively going through different things, just to give us something different. So Charity, would you like to give us a little bit about Chronically Fabulous, what it is, what it means?
Sure. So Chronically Fabulous that's my brand, that's my baby. It's basically my blog about me and my chronic illness. I've been chronic ill since I was 14, diagnosed with Myasthenia Gravis, and just recently with lupus and RA. And, it's just giving another voice to those who feel, ignored. A lot of times it's like, oh, well, you look healthy. And it's like, yeah, I'm sick, right? I'm not ugly. Because they love to be like, oh, well, you look great. You're so well put together. I'm like, yeah, I'm going to be well put together regardless if I'm missing a foot or not. Like, I'm fabulous, okay? But I am ill. You may not see it, but it's there. So I am that voice. Yes.
Yeah.
I think people equate like chronic illness or being sick with looking bad. And I think it goes for all of us. Like, I was raised like, just because you may not be feeling well doesn't mean you have to look like it. Yeah.
Yes.
Right.
For sure.
So Charity, can you give us the general overview? I know you said you were diagnosed at 14.
Yes.
So could you kind of give us the journey from 14 to
now?
Yeah.
Okay, well, brace yourself. So at 14, I started having symptoms of a droopy eyelid, And then it started with double vision, then it turned to droopy eyelid, and then it was just like right-sided paralysis um, on my right side of my face. And it was kind of like I was having a stroke, but I wasn't. And so my mom, she took me around to all these different specialists and doctors, and no one could figure it out. It took us about like 6 months before we actually got an answer. We went to this IU of medicine in Indianapolis in Indiana, and we had this Tessalon test done, which is actually no longer performed. It's dangerous. You should not do that. If you have a neurologist trying that out, you need to seek someone else. And so, yeah, my eye opened right on up. And he said, yep, that's exactly what's wrong with her. And send her out the door. We'll go find your neurologist and work from there. And so from that journey, it turned into literally like just nonstop like medications and tests. And I went from being 115 pounds to like 2 something, because I was on 175 milligrams of steroids every 4 hours. And that was to, in his defense, I keep saying in his defense, because
right.
he was
that's a ridiculous amount, but
right,
that's crazy.
It's
that's
ridiculous,
crazy.
right?
Crazy.
Yes, yeah. And so it's like, and in his defense, it was like, you can just kind of like taper off or do this and do that. And it's like, well, this is steroids. First of all, you're giving a family who has no background in medicine the control over how you're supposed to run meds. And it's like, it wasn't there. You know what I mean? It was just like, hey, every 4 hours, take these meds on clock, like on, you know what I mean? And so I was on Darvocet, I was on Vicodin. I was 14 years old. I had never taken pain medication like that before. And then eventually, my tolerance went up and up, but I ended up in a wheelchair. I ended up having to stay home from school. I was homebound, so all my teachers came to me. I missed out most of my 8th grade year. And so one day I was at school, and the next day I was gone.
Wow.
And so, from there, my at the time, my neurologist was an older white gentleman, and he was about to retire. And yeah, I feel like he just kind of threw the book at me, because he didn't know this is an illness at that time that was common in, older white women. So to have this 14-year-old girl, it was just kind of like, man, like, this is odd, but I don't know what else to do. I'm just going to throw all this medication at you. So for me, I was happy at the fact, or now that I'm an adult, I'm happy at the fact that I didn't have a crisis in terms of um, having to be intubated, because that happens a lot with us. And over the years, once I got older into high school and stuff, the symptoms just wouldn't go away with medication. So we decided to go ahead and do a thymectomy. And medicine, of course, it changes every single day. And for me, my thymectomy was pretty harsh. No one, they never gave me the rundown about about the procedure and what it was going to entail when I woke up. So when I woke up, I was intubated, and I'm freaking out.
Oh
You know what I
my.
mean? No one told me I was going to wake up with a tube down my throat, and I couldn't talk, and I couldn't take it out. They had to, restrain me and stuff. And that was that was hard. That was really hard. So at least once I got the thymectomy, things were better. But I went into remission, and no one tells you, hey, it's possible that you can come out of remission. So I went to school, I moved towns, I had children, I got married, and I thought I was fine. And then one day I'm driving down the street, and my double vision comes back, and it rocks my world, because it's scary. You know what I mean? You're driving down the street, and then all of a sudden you're dizzy and you can't see.
Right.
And I'm like, oh, well, maybe I'm just tired. I'm thinking it's my thyroid. I'm naming everything else except, hey, your MG is probably back, kid. But I didn't know.
Right.
So I went to see a neurologist after my endocrinologist was like, hey, you should go see somebody else. And she was like, yeah, but these are all the symptoms. And I was like, oh, okay. No one told me it was going to come back after I had my thymectomy, So yeah, I went to go see her, and I've been on medication on and off throughout the years, but unfortunately, last year in October, it was just last year was a whirlwind. I know for a lot of people, the years have been crazy.
Mm-hmm.
And I had, I went through a divorce. I decided to get married again. I married someone who happens to have mental health issues that I didn't know about, and it was just stress on
Oh,
top of stress, right?
Right.
Stress will bring up dormant issues. And for me, that was lupus. And with lupus came the RA. And whew, I couldn't get out of bed. I couldn't lift my legs up. I couldn't get off the commode. I couldn't get out of a chair without having to like pull up one stuff. Um, it was a lot. So yeah, yeah,
Mm-hmm.
that's me currently. Currently, I'm going through IVIG therapy. I'm in physical therapy. Um, yeah, that's where I'm at right now.
wow. And I was trying to get your attention because I wanted to I was kind of like doing the little usher finger
The
right
church
here.
finger.
What are we doing actually?
The
Because all I
church,
see is
the
Jess.
church, the usher church finger. But for those of for our audience, and because we do have patients that watch our episodes. Tell us a little bit because you talked about the test and you said that it was very dangerous. So just briefly tell us a little bit of how that was performed and if you
Right.
remember
Right.
exactly.
Absolutely. Like, yeah. The Tesla test, what I remember was he gave me a shot. I don't remember where he gave me the shot at, but it's just that the Tesla being injected is something that's really dangerous that they don't recommend doing at all.
Mm-hmm.
And now the way they verify if you have myasthenia gravis or not is just through your antibodies
Yeah.
and other tests.
Okay.
Okay.
Yeah.
So could you give us like a definition of what myasthenia gravis is, like at the
Yeah.
basic level
The
for
the base, yeah, the dumbed down version is basically weakness. Literally, myasthenia gravis means weakness of the limbs. And for me, it started as ocular, so I can think of another day. It started as ocular in terms of my vision, and then it turned into generalized myasthenia gravis, which is my limbs.
Okay.
So, like for me to do my hair, to like blow dry my hair, my arms get really weak and heavy. And
Mhm.
with rest, it'll get better. Or with walking or with, any type of extenuous activities. And a lot of times heat or the cold, anything extreme will, exacerbate it.
Exacerbate.
Thank you.
Exacerbate. Yep. You got it.
And speech. A lot of times, like if I get upset about something and I'm yelling, I'll lose my voice. And for the longest,
Oh,
I
now
just
that would make me mad.
girl. And
Yeah.
for the longest, I thought, like, well, man, Charity, that's just normal. And they're like, no, that's not normal.
Like
Wow.
lose your voice
Okay.
like mid
Are
argument.
Not mid argument, but just
Oh,
like, over time, like I'm going off and then over, within a few minutes, my voice being able to yell is decreased.
oh
Yeah.
wow.
Yeah. And so I have to rest. And it's literally and all of this, like all my jaw motion, all this, my neck, all of it, you'll feel it fatigued. Yeah.
Wow.
Yeah.
Mm,
It's wild.
very, very.
and generally, how long does that last? Like you said, with any
Yeah.
type of movement, if you're like out walking and you
Yeah.
feel that kind
So
of
and,
like,
and when I say out walking, so like for the most part, like if I was to get up and like run errands, right, for the
mm-hmm,
day, I'm going to be fatigued midday, right? So
mm-hmm,
if I get up at 9 o'clock, I take the kids to school and I go here, I go grocery shopping, I go shopping, or I go do this, I go do that. By midday, by 2 or 3 or 4 o'clock in the afternoon, I need a nap,
mm-hmm.
right? And I could probably do like a quick like 40-minute power nap and be back up, but I'm not gonna have the same energy that I would at 9 o'clock, right?
Mhm. Right.
It's like it's a lot. It's like constant chronic fatigue. Yeah.
Mm-hmm.
So, Charity, I mean, chronically fabulous. My bad. My
Yes,
bad.
darling.
Chronically fabulous. Um, one of the things I do want to kind of ask about is how does this affect you at work? Like what does your typical day like kind of look like? And this kind of like a twofold question. What does your typical day look like when you're preparing, not just yourself, because you say you have kids,
Yeah.
when you're preparing yourself, your kids to get ready, especially if it's an infusion day that you have to go
Yeah.
to, and then like on top of that, once you've already done the infusion, what does work look like for you?
Mhm.
So, hmm. So in October, I went on and leave of my FMLA leave, right? And then after that, it was just kind of like, hey, when are you coming back? And because my doctors didn't have a date to give them to come back, the healthcare field that I worked in, the hospital here in Florida for almost, 13 years, we're just like, oh, okay, well, we're going to go ahead and part ways. And I'm like, yeah, okay. I'm okay with it. And at that point, it was for me, I was done fighting because prior to that, I had been on intermittent FMLA for like 3 or 4 years asking for accommodations. Hey, are you able to help me with my desk situation? Are you able to help me with, maybe changing what I'm doing at work? Or can I was just looking for any type of accommodations, right?
Mhm.
And it's so funny because right before my time was up, when I thought I was going to go back, the accommodations team reached out and was like, hey, what do you need from us? Whatever you need for us to get back to work. And I said, man, that's awfully funny. For
Right.
3 or 4 years, I have sat here and begged you to help me, right? So that was really disappointing. But at that point, I was already just like, I'm over it because when I would be at work, the double vision would cause headaches, the headaches, the stress, being on the phone. And it was just, I was doing 12-hour days and it was just really, it was very fatiguing. And mind you, I didn't have to do 12-hour days, but even 8-hour days for all week would have been a lot too, because you have to understand, I still have physical therapy and all doctor's appointments and infusions to have to go through. And I do labs every week. So that's going to be hard to keep up with. So right now I'm applying for disability and praying that that comes through eventually. But in terms of being prepared for infusion day, I can't drive because my pre-meds put me out. And so I have to have someone take me. And if somebody doesn't take me, then I can at least Uber there and then I can get a ride, someone to transport me back home. But with my kids, I've had to have conversations with all four of them about, hey, listen, mommy's having infusion day. This is what we're going to have for dinner. You're probably not going to want to bother me because I'm probably going to be out of it. And then plus I've built a support system. I've built a village of people who understand. So I have someone to help me pick up and drop off. And, I keep trackers on the kids so I can be like, all right, this
Got
one made it
to.
to school. Great.
Yeah.
That one's on their way to work. Okay. You know what I mean? So,
Right.
and I just, for
Got
me,
to.
I make sure to I always clean up. It's kind of like nesting. No, I ain't have no babies. But for me, if my house is clean, my sheets are clean, when I come home from doing an infusion, I can just get in that bed, strip, and I am good to go. Because the resting period of it all, oh my gosh, it's a lot. And you can't really fully rest, I feel like, if your house is in a disarray. You know what I mean? Like I can't. I know some
Right.
people might be okay with it, but for me, my mental can't rest unless everything is where it's supposed to be at. So yeah, so I'm doing laundry, I'm cleaning everything else. And then a lot of times I have some really good people I know. They'll prepare meals for me so
Oh,
that
that's
all I have to
Oh,
do the
that's
next
wonderful.
day, right, is just throw
Wonderful.
it
yes.
in the oven and the kids are fed. I don't
Right.
really care about me. As long as they're fed and they're not knocking on my door, I'm good. So yeah, that's what infusion day before and after looks like. 'Cause like today, like I had infusion yesterday, and it was we had this lady call me, and I'm not saying that she just wasn't comprehending, but she wasn't, and I had to let her know. But she was just like, "Oh, well, I need a favor." Oh, not today, you don't. So you have to learn your boundaries and be like, "No, today I'm getting medication in me right now, ma'am.
Yeah.
No,
Right.
it's not
Right.
happening today. I'm so sorry about that, but good luck." But yeah,
Get
that's my
somebody else
infusion.
to do it.
Get
Yeah.
somebody else to do it. Yes, yes.
And how long are the infusion days? Like, how long are you there?
I'm there. So it depends on your weight and what you're getting because they have to do the science for it. But for infusion, especially for IVIG, your first bottle, I get 3 or 4 bottles. My first bottle is supposed to go super slow. That first bottle takes me about 2 hours to get through. So I'm there for about 4 to 5 hours.
Mm-hmm.
Yeah. So there's 4 to 5 hours. And then, like I said, today is, the day after. And, I've been kind of moving around like ain't nothing wrong with me. And I realized, man, you probably should go take a nap.
Right. You're doing too much.
I'm doing too much because I don't, for me, it's like, I got to keep going. I'm busy. I got things to do, but it's like your body will remind you, hey, listen, that's cute, but go sit down. So, yeah.
Right. Yes. I will say, I think we both have our little notepads over here. So if you see us like going down,
yeah, I'm writing as I go along because there's certain stuff I want to kind of go back to while you're talking. So just don't mind us. We looking at our questions. I'm adding stuff.
Yes.
So don't mind us.
Yes. So let me see because there's so many different directions to go through. Yeah. I'll go back. So you were 14 when all of this happened. I met you our freshman year of high school.
Yes.
So you were just coming back to school then.
Yeah, I was just coming back to school. I was just coming off of the steroids. Yeah.
Mm-hmm.
Yeah.
So how was that as adults now? How was that experience going back to school? Like, you know what I'm saying? Like just being a teenager dealing with.
Well, it was hard as all get out, only because of the fact that I was coming. So what happened, the way I was put into school, right? So the school that I was to feed into, I left to go to a not charter. It's not a charter school. Yeah, I guess this is a charter school. It's like a performing arts school. There we go. Okay. I left my middle school performing arts school. So I left the school kids that I had grew up with to go to school with another set of kids, right? Mm-hmm. And so that was kind of hard to fit in anyways. Right. And then on top of everything else, then I got sick. And then I ended up, because before I left school, I was wearing sunglasses every day to school because my eyes were really sensitive to light. And then the vision was just so bad that I was like, oh my gosh, if I just wear sunglasses, it helps a little bit. So then, kids, they're already picking up, right? Mm-hmm. And then on top of everything else, when I came back to school, the weight was still there. So I wasn't the same charity, but the weight was there on top of like the scars. And so children don't know why you have stretch marks all over you. They're just cruel. And so that was really, really hard, especially for me. Like there were days I was like, Mom, I can't do this. Mm-hmm. And it was just like, come on, let's go. And now the parent I am now, girl, I would have been all in. Listen, there would have been lawyers, attorneys, everything at that school. You know what I mean? And it was just really hard. But I'm sure a lot of it didn't help because, I did have a slick mouth. So I am going to go in, I'm going to defend myself to the best of my ability. Right. But it was really, really hard. But, like I said, having you and Maya as my friends, I tell you, y'all had my girl, y'all had my back. And it made school, it made life durable. It did. It made it easy. Yeah.
Right. Because even just like hearing your story now, going back as a child, we didn't understand. Like I knew, like even honestly to this day, I still get it mixed up. I'm like, wait, is it MG, MD? Like because I remember you would have to tell us. So you have to tell us, but we did not have the full comprehension. And even now coming in as an adult and as a nurse, I think we kind of talked about it. We hear about it, we learn about it a little bit, but it's not an area that's focused on. I still like even some of the stuff that you said through this conversation. I'm like, wait a minute, what is that? What is, like I can kind of keep it together, but I don't really know. Yeah. And so having to go through that as a child, and then I just wanted to hear your perspective because I know it was a lot. It was a lot.
It was a lot.
And still is a lot.
And I mean, even for like school wise, because it was just like I would be fatigued And I was glad that I, at least at that point when you met me, I had just gotten my new neurologist who was a peds neurologist, and she understood, okay, listen, you're going to need help. And at this point now, me as a parent, I should have had an IEP to help me, but I didn't, because I didn't
know.
My mom didn't know, my family didn't know. And so even now, it's like with college, it was like, man, I could have had help with there, like, man. But you know, but I would have naps, you know what I mean, like, because a lot of times I would get sick and I would get sick at lunch because my muscles were weak, and so I would vomit, right? And so I could like go and take naps, I could lay down. But then a lot of that too was um I had a lot of mental fog, you know what I mean? And so mental fog, mental fatigue, where I'm just kind of like, I'm over it. And so I had a lot of days that went missing, you know what I mean? And it's like, hey, listen, you can't miss any more days of school. And I'm like, well, tell my doctor that. You know what I mean? And then, you know, you get to, you know, that sophomore, that junior year, and it's just kind of like, man,
whatever.
I don't want to do this no more. Do I have to go to school? No, bet I ain't going.
Right.
So that didn't exactly help. And I feel like for parents who have children who have MG, it is so important to advocate for them, but to also know, okay, listen, are they playing you? Or do they really need it? And it's such a fine line. I'm not gonna lie, it's such a fine line. But yeah, for sure.
I just want to put in this plug here, because even though you were going through all of that, me, Charity, and Maya were the original bad and bougie. Okay, she might have been sick.
She was still going,
but we were in that high school in stilettos. We were dressed. We looked good. We did everything. So even though you were feeling all of that, we still were baddies. The original. And so Chronically Fabulous fit to the T. It fit to the T. Because we've always been fabulous.
I love it. I absolutely love it.
Why did our parents think it was okay for us to be wearing stilettos?
Don't know. Don't know why they approved that. Don't know why they let us buy them or bought them for us. Honestly, we're freshmen. And stiletto shoes. That's why
and still doing the thing.
Look, that's why my knees click every time I stand up.
That's why we having these knee pains now.
Right. I ain't got no more cartilage.
Listen, the early 2000s was a time, okay? Right. And we lived
Y'all had to been there.
Strong.
You had to be there.
Now, I know you talk about you talk a little bit about like the steroids and everything, and not to, you know, kind of constantly go back in there, but just really trying to give everyone like the bigger picture so they fully can understand. And so parents, like you said, that are taking care of kids you know, with MG or lupus, tell us, because you shared with us a story about how, like, when the doctor put you on those steroids and you became unrecognizable, not just to you know, your teachers, but also to family, your own family. So tell us a little bit about that story when, you know, your family, you know, came to visit.
Right. Yeah. I mean, it literally was within like 4 months. It was 3 or 4 months. And then all of a sudden it was just like, I had a twin bed, and my mom was just like, Charity, one day I just looked, because my mom worked third. So she had to go to work. And so, you know, she would leave or whatever. And she's just like, Charity, one day I looked in there and seen you, and you had just taken over your entire bed. She was just like, it was unrecognizable. And my niece at that time, she had to be like 6 or 7. And she was so sweet. But she was like, they were like, oh, go say hi to your Aunt Charity. She's in the room. And at that time I wasn't bedridden, but I wouldn't really get up very much because it was just too much work. And I would get, I'll go there later, but she came in there, looked at me, and she was just like, oh my gosh. She was just like, she's not in there. Somebody else is in there. That's not Auntie Charity. And they were like, no, that's not Charity. And she's just like, oh, and she didn't, you know what I mean? She didn't know what to say. And for me, it was just kind of like, man, did they really not recognize me? But now that I look back on it, it was like, yeah, it was, I had that big round moon face. And for a 14-year-old girl who's already going through, image changes and all that kind of stuff. And, I'm thinking I'm ready to get, my tatas and, ready to fill out and stuff. And then for this to happen, it was like, whoa, it was hard on me mentally, and especially in terms of self-esteem issues. Even now I have to be very, mindful of like, all right, Charity, listen, you're beautiful, focus. You know what I mean? Let's not focus on the bad parts. Let's just focus on the great parts. And for me, I always look at myself as, with all my scars and everything, it's like, hey, but you're still here. So that's something I really focus on. But yeah, at one point in time, I don't think doctors know how to fully prepare parents, right? And for me, I don't know if it was it had to be the weight of the steroids on the body that wasn't used to it. But I was in like, the pain was just really bad. And so that's why they had me on so many different narcotics. But, I was screaming and hollering, and my mom was just like, she'd close the door because she didn't know what to do. And I just know from a caretaker's, point, and from my, a parent, that is it's just so hard. It was just so hard to see her go through that. I mean, yes, I know I was going through it too, but for my mom, you know what I mean? Yeah. So, yeah.
And just, I don't know if we want to just kind of give our audience like a real quick of like why it's important to why we're talking about the steroids and why she gained all that weight. I'll let you, kind of, if you want to take it from there.
Yeah. So, because you were on prednisone, right?
Right.
So prednisone already is a steroid. It's one of the side effects is gaining weight. A lot of people that do go through different health concerns that get on it, that is one of their biggest concerns. Typically, I don't know the range that they give, but I'm going to go with 40, 60, 80, somewhere around there, at least to start. So getting on 175. I don't think I've ever, me personally, I don't think I've ever seen the order like that. Probably more, I'm sure in different settings, you probably would see different things, but I typically don't see anything too high. Maybe I may have seen 80 once or twice. And that all, of course, depends on the medical condition that you have, but the steroid is to help with the pain, the inflammation, different things like that. So did they start you at a lower dose, or they just started you straight?
They start me at a lower dose and they bumped it up. They were trying to kick in the Amuran at that time. And the Amuran was a slow acting medication. And they said, well, if we put these together, it should help, kickstart it. So
they definitely
it did something. Yeah.
It did something.
It kickstarted something. But even now that that I'm the age that I am, I have it's not bone spurs, but I have spots all over my bones. On the x-ray, it lights up because it was the oxygen loss to the bone. Or correctly?
Yep.
From the steroid use. And so even now, like, all of my doctors are in a conjunction. Hey, unless she is about to be intubated, we are not going to give her steroids for whatever reason. Like, we don't care. Like, even before, like, I was getting like neck injections and knee injections, and those are different types of steroids, and they're like, no, like, let's just
not go there. No. And that was one of the other things I was going to add as well. The weight gain, and on top of that, it weakens your immune system. I don't know if you were getting sick a lot, and the thinning of the skin, the thinning of the hair, and like you said,
everywhere.
The bone loss. Steroids, we use them, like Jess said, in different settings. And I've never seen 175 milligrams. And again, it all depends on your disease process, what setting you're in. I've never seen someone on that high of a dose for steroids. And but I definitely was not surprised. I'm sad. I was trying not to cry as you told that story, but it was it's sad to see that they didn't take the time to really fully understand what was happening and just, piled that on you and your mom. And it was kind of like, you were left to kind of figure it out on your own
Yeah.
there for a little while.
Especially with just again, I stress it so much now. Like I get it that they give you all these documents and they say, hey, read this and read that. But I feel like from a doctor's standpoint, educating your patient, hey,
Absolutely.
these steroids, they're going to make you emotional. These steroids are going to interrupt your cycle. These steroids
Mhm.
are going to make you grow hair in funny places.
Yep.
They may make you a little bit more aggressive, or you may, you know what I mean? So
Mhm.
I look back at it now and it's like we did not have the education there that I
Mhm.
know that I've seen out now. Now it's like, but with my first husband, he didn't understand what was going on.
Mhm.
I was working, I had the kids and I was working, I was a scout mom, cookie mom. I was doing all these things. And it was just like I would go to work and work third shift, come home and sleep the entire day and wake up and go to work. And for him, he's just kind of like she's in her coffin all day long. Like
Mhm.
it doesn't make any sense why she's sleeping so much. You know what I mean? Like it doesn't make any sense to him, right? And so
Right.
my doctor was just like, well, hold up, swole up.
Right.
um, she is working full time, a mother of four, and she
Right.
has a chronic illness.
Right.
Yeah.
Yes, she may push through to do things that she has to do when she needs to do that, but her body is not set up that way. And so I was really happy with her because she was able to break it down for him to comprehend, as well as let him know, hey, all these different resources are out there. There
Mhm.
are support groups on Facebook. There are support groups, with the Muscular Dystrophy Association, that meet with spouses and kids of parents who have it and caretakers who have it. And then there's just a slew of information now that's available to us because at that time, we didn't have computers in our home with, Google access like we do now,
Mhm.
you know?
Mhm.
So
Mhm.
it's not at our it wasn't at our fingertips at that point. So yeah.
I think that's a good takeaway just from that perspective for us as nurses,
Yeah.
because even though doctors will explain, we all know they aren't, unless you get a really good doctor or nurse practitioner that's going to sit with you and go through everything. And we already know those, you get those, you keep them.
Right.
Right.
But most of the time, that education part falls on us as nurses. And so I think that's just a good takeaway for us if we're in those settings and we are with someone
Yeah.
who is did get a new diagnosis, they could be a child, anything new to their regular thing, for us to kind of take a minute and try to provide as much education as we can. Yes, we all know you can click the little thing and the whole little paper, discharge, educational, all that stuff comes out, but not everybody fully even now, with the internet,
And
not everybody
sometimes
understands
they're
what
not
is
gonna
in those
read it.
papers or read it. Right. Number one, are they even going to read it?
Right.
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 Number
For
two,
sure.
there's stuff in there that you may not understand. So if we can, in those instances, take a little bit of time to
Yeah.
be like, okay, let's kind of talk about this, or at the very least, connect them with those resources that really can explain it a little bit better.
Right.
Great.
For sure.
Great.
Yeah. Where do you want to go next? So
So,
I
I was
have a
waiting. I
question.
thought you had another question. I don't want to be the one taking up all the
Right. I don't
questions.
want
So
to hear
so
full.
I do have another question here. Um so you talked about getting married, having your kids.
I think you're
Um
about to ask my question.
oh, am I?
Let's see. Let's see.
Do you
Go
Well, then
ahead.
you
No,
answer because
I'm
I
wondering
asked
if we're
the
here.
last
I
one.
love
Let's
you
see if we're
guys.
here. Go ahead.
All right. So, can you explain to us how you felt, when you first found out you were pregnant, you have this chronic disease, um, were you worried about your health? You talked about it being in remission. Were you worried about your health, and were you worried about, like, hey, I may potentially pass this along to my
Oh
first
yeah.
child.
Yeah.
Kind of tell us how you were feeling and what you did to prepare and, all of.
Yeah. Well, with my first son, to be honest, we didn't think we were going to be, I didn't think I was going to be able to be. It was like, hey, listen, with all this and this going on, it may make it more difficult in the long run for you to have children. And so I'm not saying that I didn't think I could, but I just thought it would be more of a struggle. So when I did get pregnant, it was like, oh, wow, that was easy. Okay, now what do we do now? And so all 4 of my pregnancies, I was considered high risk. All 4 of my pregnancies, I had to have a specialist just because of the fact that, yes, it is possible for it to become, what's it called when it's passed through birth? Genetic, and they can be born with it. And so those first few minutes are very crucial. My first son, I tell you, I had him and I was like, oh my gosh, he just came out looking funny. He was perfectly fine, but he was a little funny. But the one thing is that, I mean, with all 4 of them, for the most part, I was healthy. But they watched me like, they just watched me very, very closely. And one thing that I did not like at all was the fact that I understand I am someone who it's not normal. You're not going to really see this out and about. But if I tell you that I do not want your students in my birthing room while I'm pushing this baby out of my vajayjay, you should listen to that. Yeah. And unfortunately, that did not happen.
Oh, wow.
My very last baby, that didn't happen. And I was really pissed off. And even to this day, it makes me hot. Like, man, I really should write a letter to the board and let them know how mad I am still. But I don't know what happened. Now, the first child, it was a packed room just because the NICU was there on standby. I had, respiratory there just in case. And I had already been having some symptoms that looked like it could have been preeclampsia. So they weren't, you know what I mean? So they were just nervous and they're being prepared.
Right.
But like I said, this last one, it was just, the room was packed and here I am. And it just really irritated me, if nothing else. But yeah, I wish I had been maybe a little bit more vocal on how I felt at that time again. I don't know. I just wish I had been a little bit more vocal.
Mm-hmm.
But yeah. So that experience was a little rough, but for the most part, I did fairly well. I know my last child though, they couldn't figure it out. I couldn't lay down without like a gargle or like a choke or something. We don't know. We still don't know what it was, but to this day, it's like I could not lay down. I had like water in my throat, and I was hospitalized for.
I said, "Oh my goodness, that sounds like a lot."
Yeah,
it was like I was choking, like I could not lay down. It wasn't heartburn or anything. It was literally like water in there. But yeah, so I it was a rough show with all 4 of them. I'm not going to lie, but they're all healthy and they're all wonderful, beautiful children. So yes, I just know that looking back on it now, I probably wouldn't have had as many children as I've had, but they're here now. So
awesome. That's a blessing.
Yeah, it was a blessing for sure.
So to kind of piggyback off of that, how do you explain your diagnosis to your kids, and do they have certain things that they're aware of? Or
I don't know. I mean, I explain to them as best as I can. I've had, like with my ex-husband, it was been a very negative conversations about, your mom and her illness and that kind of thing. And I had to go and talk to them like, hey, listen, sometimes mommy can't make it to your field trips because of this and that and the other. Or, why do you have your scars? Am I going to get those scars? Having conversations based off of their age when they're ready. You know, I have 4 of them. They're all different ages, and I have to just explain to them and let them know. So, yeah. Especially letting them know that it's hereditary in terms of like the lupus and the RA, and just things to look out for as they get older. So yeah.
And just to kind of talk a little bit about that, I think you're doing a great job in
Yes.
regards to explaining to them not just about what's happening with you, but giving them the signs, telling them about your health history, because how many of us can say like, oh, I know exactly like what my mom, my grandma, my grandfather, my dad, you know what I mean? A lot of, and I'm gonna be honest, a lot of us, our families, we don't know like our parents' health
Mm-hmm.
history or our grandmother or grandfather, you know what I mean? It's something that a lot of times that's not always discussed, that it's very
It's important.
important. It's
Yeah.
very important.
And
Um,
especially for me, for just safety reasons, because of the
yeah,
fact that if I am driving and I do pass out, if I am driving and I do get into an accident because I can't see or whatever may have you, hey, mommy has this card. It's in my wallet. You pull it out.
perfect.
Hey, if you need to stop my car, you know how to put my car in park. You know that there's an SOS button in my car. You push the button. You tell them what's going on.
Mhm.
um, if I'm at home, because there are medications that will give me a negative reaction. And let's say for whatever reason, I'm not paying attention, which is highly not going to happen. But if I'm not, and I do have a reaction and, mommy isn't talking, is talking funny, or, hey, I'm telling you that I can't breathe, there's just that letting them know, hey, listen, don't be scared. This is what you're going to do, and having those conversations ahead of time, only because of the fact that now that I am divorced, I'm the only adult in the house, right?
Right.
And so
Right.
something hits the fan, you know what I mean? We all need to
It's
have a game plan
yeah,
ahead of time versus them all freaking out and crying. And it's just like that would make the situation like
worse.
10 times worse. You know what I mean? And so it's funny because I have girlfriends who are just like, oh my gosh, you're so calm. She called you screaming and crying. I said, well, yeah, I gotta be calm. Because if I'm not calm, they're really going to freak out.
Right,
So
right, right.
I have to have a sense of calmness. And I'm like this because I know how to make sure that I pre plan stuff. You know what I mean?
Right.
Yes.
Now, listen, God can come in and be like, that's cute, but we're going to shake it up a little bit. But in the most part, I try to be prepared.
I love it. I commend you on that, and I listen. I absolutely love that you have all of that, and you talk to them, you set them down, and God forbid any of that is to ever happen. They know exactly what to do in that situation. So I
Yeah.
definitely commend you on that.
Yes. Yeah.
Thank you.
So again, in this same area, how do you date with
Girl, your
Oh,
girlfriend ain't got
you
no
got
problem in that
it.
it
situation.
was on my mind. How do
we
you
going, we going there with
I
it.
gotta switch
Okay,
up.
Yes.
The tear was
take
forming
it
right
up.
here. I said I was gonna cry. The tear was coming here.
I'm
So
so
let's
proud of
spice
you,
it up.
friend. I'm
Yeah,
so
let's
proud
switch
of
it up a
you.
little bit.
How do you
I
date?
do have to have very when I mean when I first meet somebody, I probably don't have the conversation. Now
Okay.
if I have my chest out, you can't miss my scar. You know what I mean? You're like, oh, you had open heart surgery, and I was like, kind of, sort of, not really. But I mean, yeah, my heart was open, so that makes sense. But I do answer questions, and then like as the relationship progresses, I have to be very, explaining, hey, listen, this is what's going on with me. If this doesn't seem like something you want to deal with, you can go now.
Fair.
Because
Fair.
it is a lifelong situation, and I could get worse in a couple years, or I could just stay the same, as long as I take care of my health and I stay on top of things, I could be right in this space here. But again, as someone who's coming into a relationship, and I would eventually like to get married for the third time.
Third time's the charm. The
Third
first
time's the
two
charm,
don't count.
right?
Definitely the first one. You
So,
already know how I feel about the first one.
right.
That one definitely don't
I
count.
don't
We
want to,
don't
I'm
know
not
what we were doing.
even
You said
moving
the
down
first
the
one don't even
aisle.
count.
Right.
Anything prior to yesterday Anything prior
Girl,
to 12,
listen.
13, 2024 doesn't count.
No, 2025, all new stretch over. Listen, we're redoing it at the beginning of the year. And so I have to make sure they understand. Like, I'm never going to hide anything from anyone, as well as I need support sometimes. Like, I sometimes need you to pick me up from someplace, or I may need you to leave me alone for a couple of days.
Right.
Or I may not talk to you for, a couple of days in between. Hey, what are you doing? I'm asleep.
Right.
I'm out. You know what I mean? Or I had a long day and I'm sorry I didn't get back to you, or I couldn't call you, or I couldn't FaceTime you, or whatever have you. You know what I mean?
Right.
Or even just preparing for dates. Because yes, even though I personally love the dating phase, right? I like to get dressed up and cute, but that takes a lot of energy.
Right.
Dating takes a lot of energy for me to get dressed. Like, no lie, it's a lot. You know what I mean? Yeah. I gotta sit under a fan before I put my clothes on, girl. I'm sweating. It's perspiring. Girl, the hair done curl. Look, all this is BB'd up. Listen, it's a lot, right? So I just have to make sure that they understand, hey, listen, if I'm giving you some of my time, you are really important.
Right.
Because I could be at home under my fan, chilling, so happy.
That part.
Right. And then another thing too is also having to understand being accommodating when it comes to sex, right? I never realized it. I just thought maybe I was just not being conditioned. Maybe I was just out of shape. And that's not the case, because some sexual positions require, you to use your limbs, right?
Right. Yeah.
And mine happened to be weak. And so it's just kind of like, man, I'm just like, they're like, oh, you're done? And I'm like, well, not really, but I'm just
give me a minute.
Right.
Relax.
Nah, like we done. I'm cool. This is great, but I'm tired now.
Like, it was fun while it lasted, but
right,
I gotta go to bed.
Right. I use all my energy. Are you good? Great. Okay. Yeah.
Let's try this not, the Jerkins is in the bathroom.
Right. Right. Because even my wrist at this point, I'm good. All of me's kaput.
Right. But for real, like, we're women. We're not old, or everything is still working. So those are things that people need to be educated. Like, you got to be aware who is really talking about. Like, if you get newly diagnosed with this, everything is going to be affected, including your sex life, and like, you're going to have to, you and your partner are going to have to find different positions and how to do this, and maybe even adaptive devices and whatever else you need. Like, those
listen, because I was about to say, get one of them swings.
Girl, them swings ain't for everybody. I feel like if you get a swing, if you are of a certain stature and size, you need to get one with an extra large seat. Because if not, they are not for us.
But I follow a girl. I'm gonna send you the link.
Oh, okay. Thank you, Boo.
Oh,
there you go.
We didn't go all the way up, but I'm gonna send you the link. We didn't got all the time. Baby girl got some products for some things, okay? So I'm gonna make sure you follow her. And we'll swing this topic back around.
Right. We're gonna bring it back. Okay. But yeah,
but real talk, those are things that like Jess said,
to have a conversation.
Yeah. Exactly.
Yeah. And even when we prepped about this, I didn't even, of you talking about dating and stuff, I was like, oh yeah, but I did not think that
even
would take it that far.
Even in a marriage, you have to understand, hey, listen, I have 4 kids. I'm tired. I'm this and the other. And you may not be able to have that intimacy like you want it. Mm-hmm. And it's because I'm exhausted, right?
Right.
And if you as a male or your partner can't understand that, then there could create some problems with friction, right? And then that can lead to some other things. And so for me, my whole thing is, hey, listen, if I'm like, hey, I'm out. I don't want to. And unfortunately, those conversations went on deaf ears. So, next.
Right.
Just next.
Number
but
3,
I know, I have a couple 100%. Of friends that I follow on the gram, and it's this one guy has MS. And, MS and what I have, they're kind of grouped together. And he was just saying that, someone that he was talking to for about 6 months decided this wasn't for them because of his diagnosis. And he's just heartbroken. And I'm just like, man, I really feel bad for people who are, newly diagnosed and who are single, who want to be with someone, because it's hard. It's really hard. And I can understand how some people would want not to date us as a community, just because of the fact that you do have to make a sacrifice and you do have to be, accommodating. So if you can't be selfless, then dating someone with a chronic illness is probably not who you want to be with.
Absolutely.
And that goes back to what she said, is like the invisible illness. So they could meet you and be like, this is a beautiful, like, I hear you, but until they really see you, and that's just anybody, like anybody, your friends, whoever you come in contact with, will see you, but we don't understand the full extent of what that, like, it's a physical weakness. It's not just you being like, I'm tired, or our day-to-day, our regular tiredness. This is a physical thing that's going on that we don't understand if we're not living with it.
Exactly. Right.
Yeah.
Gotta be in the trenches.
Do we know like the average age that someone gets diagnosed with this? Is it
with MG? MG, like I said, when I was diagnosed, it was like late, older Caucasian women, like 50s, 60s.
Real okay.
Wow.
And so now that I've been doing more of like the convention circuits with like the muscular dystrophy associations and different companies who are pushing their clinical trials out there, I'm meeting more of my peers who had it when they were like 9, 10, 12.
Really?
Yes. Wow. Or who just got diagnosed in their early 30s, late 20s. And it's like, wow. And it's hard, but it's refreshing for me, because it's like, I'm not in it alone. Because a lot of times I'll meet people who have it and they're older. You know what I mean? They've already lived through their life and they're in the retiree, and then they get it. Right. But for me, it's like, hey, I'm in my prime. You know what I mean? So,
right.
Yeah.
So it is younger. Is it? Because I was thinking that it would have been older, but so yeah.
Yeah. The average is older. You don't see a lot of pediatric patients for sure now.
Okay.
Yeah.
Wow.
Yeah. Wow. I'm a snowflake. That's what they call it. They call myasthenia gravis patients snowflakes, because we're all different and we all present differently, and all of our triggers are different. Because for me, the heat is a killer. Like in the summer when it is like, 98 and 99 and plus, that literally makes me sick. And it makes me sick to the point where like my entire face gets red, which is more of the lupus, but like my face gets red, it gets tight, my entire body will swell. And it is just like, I just have to go to bed. I have to be cool down, cold shower in the house, not leaving. And that's how bad it is. But even in the winter though, it's like, if it's too cold, if I'm too cold, I just don't want to do anything. I just want to be warm and not budge. So, yeah.
Wow. So, I know you also kind of talked about your religious background, your family. Tell us about, about that. How did it affect your treatment? Because you're with your mom. Your mom is your caregiver, so she is making those decisions for you as a child. And now, you're an adult and you can make those decisions yourself now. But how did your religion kind of affect that, and how does it affect your treatment now? With these new clinical trials and new drugs that they're finding.
I mean, at the time, the clinical trials and those kind of things weren't presented to us. And I don't know if that was because of just where we were demographically in the world. But excuse me, I almost wasn't even able to have my thymectomy removed, because it was a major surgery, and the anesthesiologist wouldn't sign off. So I went in on a Monday to have my surgery, and mind you, this had been booked for months out. I had already had everything planned out, and it was like, okay, the day of going in, and it was like, no, we're not doing your surgery today. And it was like, why? And the anesthesiologist wouldn't sign off, because he understood that my mom was like, listen, she is not to have any type of blood transfusion. And having a major surgery like that with opening your chest like that, it's a very possibility that something could happen and I could bleed out. And so, with my mother's religious beliefs at that time, it was, I don't care. You can fight me. You can take me to court, but we're not giving this child blood. So my father had to actually be there, who was like, well, listen, this is how she feels. You know, we're going to stand by her. And we had to go with another anesthesiologist, because he was like, he couldn't, from his own standpoint, let me die on that table.
Right.
Because of not being able to have a blood transfusion, which is understandable for anyone. Even now as an adult, I wouldn't do that to my family. I wouldn't do that to my children. I understand my mom's beliefs, but I'm not that person. So even with her healthcare now, she knows that I'm not to be, you know what I mean? I'm not the person to make decisions on her life because I don't have those same beliefs. So we had to come back a week later. And during that time, I did a lot of iron infusions, just to make sure that we had me prepped and ready to go. But even with the IVIG, the plasma exchange that I'm doing now, I wouldn't have been able to do that as a kid because it had to do with, some type of blood product. And that was just a no-go for her, so yeah.
And just to kind of give some context to, our audience that are watching, what is your religion, if you don't mind sharing that?
So now I'm a Christian. I've always been a Christian, but when I was growing up, I was being brought up as a Jehovah's Witness. So yeah. And yeah, we'll leave it at that.
Yeah.
But
we don't want to step on anyone's toes.
We don't want to step on
right. No, we're not gonna go there. But just
understand.
for those that are watching, and like I know we'll have like other nursing students and some med students that'll probably tune into this, so they're not assuming or making assumptions like, oh, she must be this religion
or that.
Yeah.
And to understand the importance, a lot of the time, on our assessments, we have to ask that as far as religious,
they do.
religious beliefs, because that does affect how we provide care. I've never been in a situation, probably because I don't really work in the hospital setting or anything like that, but I haven't been in a situation where that has affected the care, but it can. And I don't know. Have you ever had anything like that? Like, what do you do in those instances? Like you said, the anesthesiologist didn't want to continue.
It's a lot of paperwork. I'm not gonna lie.
Right. So okay.
To make sure that the hospital doesn't have any type of liability on their ends. And a lot of times, you have hospitals who will try to fight it, who will say, no, we're going to take you to court, or we're going to do it anyways, and then you can fight us later. Right. So yeah.
Yep. As she stated, it's the liability piece. And I have been in a situation, had a patient, they were, researching, trying to find another drug to give this particular patient. And they did find one, educated the family on it extensively. And I just remember like a lot of, hospital administrators being in the room, the doctor, the specialist. I think we even had someone from legal come down. It was like she said, it's a lot of paperwork, and it was like a lot of, because it's like, hold up, we're not about to let this patient die.
Especially
we have a
minor
responsibility. And this patient wasn't even a minor. You know what I mean? This was an adult patient, but because of their religion, the wife, the kids, they were adamant that like, no, he's not going to get this one. You better find something else, or nothing. Right. And it was like, we can't do that.
No. Fair. So that question on the little assessment does matter, guys.
It really does.
It really
absolutely does matter, because if you don't act,
it does matter. It's going to direct your care,
and put it on there.
When we get into the habit of doing different things and stuff, sometimes questions like that, we're like, oh, do you have, is anything of concern with your religious beliefs? Most of the time it's no. Sometimes it's yes. But the details.
Listen, even the DNRs, and that's something for a whole. I
Yeah.
found out
That's major.
something today. Well, not today, but like earlier in the week, and like it differs per state. Okay, so like
The
you
DNR.
may, yeah, you may
Okay.
think that, oh, like the sibling can sign, or okay,
Hmm.
there's no sibling involvement. This person, that's a family member, they can sign. Listen, you better know when you move to these certain states and you have certain legal paperwork like your will, your DNR, especially
Hmm.
DNR, POA stuff. Please make sure you look up those informations, but we're not gonna get into that. We want to
Yeah,
stay
because I
on
was gonna say we
topic.
can get into that. That's gonna be a
Yeah,
separate one because
yeah,
you
that's
got
a
to make
separate
sure
one.
you have your paperwork.
Have
Have
your
your
paperwork
paperwork.
in order and make sure y'all are checking off and writing in what that religion is because
Or
it is
in
important.
right, whatever. Yeah, yeah, we can get off on a tangent on that.
Yeah, for
But
sure.
okay, you got anything? I do have one more.
I listen. I feel like I've been asking all the questions, so
No,
I'm just trying to
no,
let you,
we were going through our list. I do have one more. So your mental health. How do you protect your mental health in this space?
In this space, oh gosh, I don't know. I've been doing it on and off for so many years. Um, it's hard, and I have to make sure I have reminders, and I remind myself not to judge anybody else where they are in life
Hmm.
based off of where I'm at. You know what I mean?
Okay.
Because, I didn't finish school. I didn't finish college. And that's bothersome because I have sisters who have, you know, doctorates and masters and two masters. And, my nieces are this and the other. And it's like, okay, but Charity, you moved across the country.
Hmm.
You had four children, and you're doing it alone.
Hmm.
You're doing good.
Yeah,
You know what I
You're
mean?
doing
absolutely.
Like,
great.
Hats off
be
to you.
be proud and be happy about where you are in life, and just remember to take it one day at a time and to keep
Mhm.
swimming. That's what I call it. Just keep swimming.
I love
um
it.
and I do a lot of journaling. Like I said, I am writing a book,
Yes.
which has become very therapeutic for me, to get it out there. And I'm hoping that my story reaches people, from all different walks of life, and it helps them in their daily life. So yeah.
Yes.
Awesome. Awesome. Um, so I'm gonna kind of put it into one question. It's actually a two-part question.
Okay.
So, um, what advice would you give? And I may have already asked this, but like, what advice would you give parents and going through this in regards to how to advocate for their kids, what questions to ask, um, and just how to be more supportive, family members, aunts, uncles, that
That's good.
their support system, because everybody's support system, everybody's tribe is different. And
Oh
so
yeah.
just trying to what advice, if any,
Oh
if
yeah,
you
for
met
sure.
someone today and they told
Yeah.
you like, "Hey, I saw this episode," what would you tell them?
Especially for parents. For parents, my main thing is to make sure, that you get in touch with your local, like muscular dystrophy associations, because for one, I was a Jerry's kid. They sent me to camp for 3 years in a row. It was paid for, 100% paid for. And I do charity work for them now. And it's something that's full circle for me because of the fact that, I just did a charity event and we raised almost $200,000
Wow,
That's good.
in
that's
one night.
amazing.
Right.
Congrats.
Yes.
Right. It felt so good for me because we had a kid there who goes to camp, and he's a sweet kid. I can't even think of his name now. But he was just like, I go to school with kids who don't look like me. And then for 1 week out of a summer, I go to camp with kids who look like me, who understand what I'm going through, you know what I mean? And we are all on the same page and we know each other's struggles. That is huge. You know what I mean? And I feel like the way I was able to go through this and come out of it the way I was is thanks to camp. You know what I mean? That being away from your family and having, you know, a normal space
Mhm.
is just I can't even explain it. It was just something that was for me at that time when I really needed it. So for parents to make sure that they do go out, they find support groups, they make sure they go and get their kids either 504s or IEPs in their school system, to let teachers know, hey, you need to make accommodations for my child. My child is going to need naps. My child is going to need less strenuous activities throughout the day. And when they do, they may need more rest. Or, hey, you know what? They may have some brain fog. You may have to give them less homework. You know
Yeah.
what I mean?
Mhm.
Um, it's just being an advocate for your child is major, as well as letting your child be informed as much as possible, for their age, right?
Hmm.
Letting them know, hey, listen, this is what life is going to look like, right? And we need to make sure we stay on top of this to make sure we get you to where you need to be in life.
Right.
And of course, that's for any parent, but when it comes to a kid with chronic illness, it's like that times 10, you know? So you do have to worry on top of, and it's a lot for a parent. Parents need to make sure that they're minding their mental health, that they have their own support system of other parents who have children with chronic illnesses, not just myasthenia gravis, but with any kind of illness as a parent, because it is so much to have to deal with already in this world. And then on top of it, having to care for a sick child, on top of taking care of yourself and your well-being is super hard. So that is my biggest takeaway, is to make sure you find those associations, the nonprofits that are there to help you, because they are out there, as well as register your child in the national registry. um, it's something that I feel like is really great, because it will follow your child's medical record, and it'll follow their prognosis and how they're doing, as well as helping to get to a cure, which I think is great. Um, Also, they do clinics where if you need anything, your child
Hmm.
needs a wheelchair, your child needs a walker, they need bathroom products, they need, hey, I have something funky in my house that could be made better for my child. Can you help me? They can help come bring in contractors to build and fix things for
That's
you.
great.
Um, the support is there. You got to go look for it.
Hmm.
It's a lot of work, not gonna lie, but it is
Yeah.
there. There are grants and companies that were there to help, that I wish I had have known more about as a kid,
Hmm.
or that my mom knew more about, more support for her. But yeah.
Awesome. Awesome. Well,
It's so good. I've learned so much.
I have too. Thank you so much for
Yes,
sharing your story with
You're
us.
very welcome, you guys.
yes, I made it through without crying.
Yes, me
Oh,
too.
proud of
A couple
you.
times you almost had me twice, girl.
Oh
Twice.
Almost,
my goodness, you guys. I'm so
almost
proud of
made
you.
it
But one
through.
more thing before I go, please make sure, if you are a brown snowflake, you are checking out the MG Holistic Society. They are a group of LBGQ. I might have missed some letters, y'all. My bad.
They know.
As
They
They
know.
know.
they know they're in there, as well as brown snowflakes. It's a society for us, and they do a lot of like wellness and holistic retreats. They have one in Atlanta, they had one in Arizona this year, and it's a one whole week. And they do have scholarships. Don't worry about if you can't pay
Okay.
for it. And yeah, it's a great retreat, and it helps you with like just ways of like, how can we exercise when we have this, and what can we do to eat, and what can't we eat. And it was just great. It was a
Yeah.
great experience.
Yeah.
And where can if people want to reach out to you or follow you, what are your social handles?
Yeah.
Oh, well, yes. Listen, are you guys able to add stickers in here? Like, can
Yes,
you
we'll
like
we'll
put?
add
Yes.
all of it in there.
Yep.
Yep.
Okay, yes.
Yep.
Well, listen, I'm on Snap, I'm on Instagram, I'm on Facebook, I'm on TikTok. I do lives on TikTok. So you can catch me throughout the week. I do random lives, and I do talk about my MG. So if you have any questions, please feel free to email me. And yeah.
Yes.
All right.
Well,
Awesome.
yes. This
And
this
she has a clothing line. And she has a I'm sorry, you got so many things going. I wanna make sure that they know that you're doing things
I
that
yes, I'm working on doing my chronically fabulous port accessible clothing line, and I will have stickers very soon. Just supporting us, letting people know, hey, you may not think we're disabled, but my handicap sticker says differently.
Yeah.
Please
I
mind
love
your business, okay? Yeah.
Oh my gosh, I love
I
it.
love it. I love it. Well, yes, we'll definitely hang on because we have to also empower our audience. So we will definitely love your input in this portion as well on different career opportunities. Of course, we talk to healthcare professionals, people that are nursing students, medical students that's getting into the field. So out of all that we've heard today, if you are interested in working with this demographic, being more educated on what's going on there. We talked about the infusion, so phlebotomists are definitely needed. And that is something that you get a training for
Yeah,
that.
absolutely.
If we need good stickers. Unless
Very,
be
very
real.
true.
I will be honest, I'm not a good sticker. So because I haven't been in a field where I really have had to start too many. So that is something that I'm taking away, especially now that I have gotten into different areas, is even taking the class as a nurse to get that different type of training. But if you are, interested in that, that's one area. Getting certified. Did we say they were rheumatologists? Was this a specific name for the nurses that you found?
One was a rheumatology nurse. The other is a infusion nurse,
If you, yep,
and then also a research nurse. So
yes,
the clinical trials and things like that. You need a research nurse to be on top of that to assess for side effects and
right,
follow up with the patients throughout the clinical trial. And
yeah.
all of these, believe it or not, they pay very well,
They pay
and
very
they all were
well.
offering sign-on bonuses.
Yes, they all of them have very good pay. Some of the qualifications were, either your ER nurses, your hospital nurses. So if you've been in those type of fields, and you can kind of do you for the qualifications. You've been in the ER, you want to try something different. This may be an area for you to look into.
Absolutely. And then just, a little bit for our med students, when you're getting your match and matches and whatnot, um, you are needed in this field. When
Yes.
we did the research, and just looking like in the rural areas, um, there's very limited rheumatologists in these areas. So like Alabama, um, Mississippi, Louisiana. Um, it's just when you're in a rural area, if you're not near a city, from our research, we noticed that you're gonna have to travel to the nearest city,
Mhm.
the most populated area in order to really see that specialist.
Right.
And so, more of you in this area because there are a lot of us, and as chronically fabulous stated, a lot of times a lot of us don't get diagnosed till later in life. And even if you get diagnosed early, we need you. You know what I
Mhm.
mean? We need you in this field.
Right.
So
We definitely
especially
need.
especially at home, because I could have done my IVIG at home, but I it, getting pre-authorizations
mhm.
is so tedious.
Mhm.
And listen, we started this process beginning of January. I didn't get approved for my auth until like April, May.
Mm.
Mm.
So, you know what I mean? It would have
Right.
been nice if I could have had a nurse come in, but unfortunately, I got approved to go into the hospital instead. And it was just too much work to have to keep fighting, and off to get a in-home nurse because
Mhm.
these treatments are really expensive. You know what I mean? They are really pricey. So
Yeah. Yeah. And I think even more so, we found as well, it's not a lot of Black rheumatologists.
Right.
So It was actually very slim. So if y'all out there,
Very slim pickings.
Please inbox us, especially if you're in
get out,
Florida.
get into.
Right.
Don't forget this field, this portion, because
Right.
that is definitely, we don't see it even in a quick search. It wasn't too many people that popped up even at these big major teaching hospitals.
Hospitals.
We're not finding them.
Or females.
Or female, right? That's even smaller. And I know we've
Mhm.
talked on different episodes about the need, and how small it already is for us as Black professionals. But in our specialty area, something like this in rheumatology, I don't know if we looked up neurologists, but in those niche fields, we need to see some Black people. So,
and women, for sure.
and definitely women.
Women.
Yeah. Yeah. Well, I think, are we at the end, guys?
I think so. I know
We wrap
sometimes we usually close with something that's
something
happening in
positive.
yeah, something that's happening in the news or whatnot, and then we close with our positive.
Yeah.
But you know, I'm
What's
trying to
been
think
happening
that
in the news?
there's been
Have
so
y'all been
much.
quiet out there?
No,
We
they
been quiet
have
in the
not.
news?
We have had real quick, I've seen where a couple nurses have been held against their will, where families were berating and belittling a nurse.
Yeah, yes.
Then we had another one where a owner of a very big home care franchise uh blocked the door,
Yeah.
refused to allow the nurse to leave. Um and just a quick update on that one. She actually lost her company. The franchise was like,
Well,
"Oh no,
fair.
you don't."
Yeah,
Which
I
which
bet.
she shouldn't have
Right.
done that. Like, you cannot do that. And so, there's been a lot. We had the unfortunate
Mm-hmm.
situation with the United.
Yeah.
Um and so it's been a lot. Also, I saw one on a positive note.
Okay,
I
yes.
saw where we have a female
Okay.
Black neurosurgeon at Vanderbilt, and they said it hasn't been one in, I want to say, and now don't quote me, but I know it said a very long time. I think it said 140 something years.
Wow.
And I
Wow.
was like, wow,
Okay. We got some
absolutely
Amazing.
wow. And
Yes.
baby,
Yes.
sis is got it going. Oh, okay.
Okay. Yes.
I
I
love it.
said,
Shout out
I
to her.
love that.
Yes.
Yes.
Yes. I love it.
So I will definitely find that and send that out to y'all. When I read it, I was blown away. I was like, it's been that long. And I was like,
Yeah.
absolutely amazing. Absolutely
Mhm.
amazing.
That is amazing. Shout out to her.
Yes.
That's good. Another reminder that we out here and we doing
Yes.
our thing.
Doing our thing. Doing our
We
thing.
gonna remind you on every episode we're out here, we're doing our thing.
Yes.
That's the whole point of everything. But yes. So yeah. So again, chronically fabulous. I am
Thank
so
you.
glad that you accepted the offer to come on here and just
Yes.
talk to us and share your story. And I think on a personal level, I think you're just an amazing woman. And to hear your story
Super dope.
and
So
to
dope.
Thanks,
hear
Fran.
all of the things that you not only go through, but that you have overcome is just beautiful. And I am so thankful to know you and to have you in my life and to be a part of wherever your journey is going to take you, which I know will be great. The people that will come across your story, your page,
Yes.
will be benefited. And I'm excited to see where that goes. I think we both are. We're both
Yes.
excited to see how this grows and to see the people that will be helped from it. We'll probably they'll probably come on here and tell us something else.
Right. We definitely looking forward to you coming back and sharing more and telling us how, like, chronically fabulous, telling us about how the clothing line has grown, and talk about
Yes.
I just see so much happening for you, and branching out, and the resources that you'll be able to offer
Yes.
chronically fabulous, and will be able to offer others. So I'm so happy that you decided to share your story,
Yeah.
and I'm happy we were able to get through it without crying a
Yes.
couple
Yes, I
times.
am too. Listen,
But you
appreciate
are
it.
I was
so
going to.
your name definitely fits you because you are definitely fabulous and so super
Absolutely.
dope. So keep doing what you're doing.
Yes. Yes.
Thank you.
And again, we will post all of the connection things, your Instagram, your TikTok, but definitely if you're watching this, if you enjoyed, not only subscribe and like to our channel, but also follow Chronically Fabulous and support, even, if you don't necessarily have MG or anything like that, a like, a share, all of those things help, we know, in the social media world. So go ahead and go over there, run those numbers up, run our numbers up, just
Run
share
it
it all.
up.
It's all
Yes,
good
all
stuff.
the way up.
Run everything up.
Yes. Well, thank you guys. Thank you, ladies, so much for having me. I greatly appreciate it. And again, if anyone wants to donate for anything, Muscular Dystrophy Association is the charity that I actually help with. And yeah, love them. I'm hoping one day to work for them and put on my own events soon. So yeah.
Yes. And we would
Awesome.
love to support. Yes.
And
I think that would be great.
have
Yes.
us in the building. We would definitely
Yes.
love to support that
Yes,
Love
for
it.
sure.
absolutely. Okay. Well, I think
Right.
that concludes episode 3.
Yay!
Yes. We will see y'all in 2025.
2025. Merry
Yes.
Christmas and Happy New Year,
Merry
y'all.
Christmas and Happy New
Happy
Year.
New Year.